Good morning, everyone. My name is Marcia LeClaire. I'm the mayor of the great town of East Hartford, and I'm fortunate to be here on this historic decommissioned airfield, along with Governor Ned Lamont, U.S. Senator Richard Blumenthal, President Christopher Cagli, Commissioner of Public Health Deidre Gifford, and Community Health Center founder President Mark Maselli. And also I want to take the time to recognize Representative Jason Rojas, who is also here with us today. Today we're here to talk about partnerships that have joined together to bring about transformation of a decommissioned airfield and turn it into the largest drive-through vaccination center in Connecticut. Able to move over 1,000 cars a day, and will likely, as you will hear a little bit later, ramp up that to make a significant number of vaccinations available. Partnerships like what has been brought together today, those of Pratt and Whitney, the state of Connecticut, the town of East Hartford, our Connecticut National Air Guard, all have joined together hand in hand to make sure that we can provide the necessary vaccinations to the general public in the state of Connecticut. It is now my distinct pleasure to introduce Mark Maselli, founder and president of Community Health Centers, a federally qualified health center, who has been a key partner in providing not only the drive-through testing that is happening on Rentschler Field here and in other places throughout the state of Connecticut, but also a major partner in ensuring that our residents, not only in East Hartford and the surrounding towns, but throughout the state of Connecticut, receive a vaccination in a very organized, prompt manner. And so without any further ado, I'd like to introduce Mark Maselli.
Well, thank you so much, Mayor. And, let me add my voice to the chorus of welcomes to everyone to the opening or the second week of our Pratt and Whitney Airport Mass Vaccination Drive-Through Clinic. That's a lot, but it's an exciting opportunity for us. Today, we will see 1,600 Connecticut residents and provide them a vaccination. And, it's not so much the numbers, but it's about the story. We had a young nurse practitioner, probably 25 years old. She came back into the trailer after she'd given somebody a vaccination. And while she had the mask on, you could see that she had a smile ear to ear. I've just vaccinated somebody who was 105 years old. I mean, that is something you'll remember for your entire life. And I think this generation of health providers is seeing that. And also, I kind of like it when the kids driving their parents are 80 years old. It makes us feel a little young. But, it is a incredible story of what's happening, not only here at Pratt & Whitney Airport here, but rather all across the state. Now, we have, because of a certain generation of ages, they bring gifts, flowers and candy. But I should tell everybody, the only gift that we need is that when you go home after you're vaccinated, tell a friend who might be a little reticent or hesitant. That's the gift that we really want, because we need to make sure that everyone is vaccinated. And the only way we're going to do it is by the force multiplier of anybody who's been vaccinated. Tell that story, share the word. I want to briefly just tell you about the history of this facility here. And it's a short one. 2.5 weeks ago, the governor said to his folks, rev up your engines. We need some more of these larger facilities. And so on January 11th, for the first time, we came out to a very long runway with no power or electricity. And 1 week later, we were able to vaccinate our first Connecticut resident. We're so proud of that. We have a saying at the health center that we're proud of what we've accomplished, but we didn't do this on our own, and we can't move forward alone. And I really want to acknowledge first the mayor for her town's effort to help us with traffic and logistics. And then I want to thank the president of Pratt & Whitney. Chris, thank you so much. We're doing testing from Cagli Park in Stamford to Long Hill Road in Groton, from Hammonasset to Thompsonville. We deal with a lot of contracts, but never have we dealt with a company that in one day was able to turn around a fairly complex contract and then add to that they were able to provide us logistic support. So Chris, thank you and the Raytheon family and Pratt and Whitney for everything you do. I want to salute General Yvonne and the National Guard, Major Mastrocola, and I think Sergeant Herrera is here. Thank you for the work that our troops are doing here in Connecticut. We have 40 full-time National Guard, and just make sure you give them a shout out when you see them. They're doing incredible work, not only here, but all across the state. You know, I want to thank Dr. Gifford and the Department of Public Health. Incredible leadership Dr. Gifford is providing, and just an incredible team of people who are working so hard. You know, we have this opportunity of private businesses call us all the time. Friends at Lyman's Orchard, they heard we were on this long runway. They gave us 10 golf carts to help us out. The private businesses are helping. And then I want to thank the folks over at the CDRA at Rensselaer Field, Derek Miles, and their whole team who's been so helpful. And then finally, Governor, I want to thank you for your leadership. You know, we get to watch you on social media all the time. And, you know, I don't know if you say a mantra every day, but what I hear you say is that Connecticut works when we all work together. And that is so true. And what you've brought to this state in terms of bringing people together, we can't do this on our own. We need everyone's engagement and involvement, and we thank you so much for that spirit that you're bringing. And then, you know, the governor can only do so much. We need Washington to act, and we can't have a better representative and leader than Senator Blumenthal and the work that he is doing. He is our voice in Washington, and hopefully with this new administration, and he doesn't need me to tell him what he's heard, which is we need more vaccines. Our state and our local governments need support, but more importantly for us, and he has been a great champion, community health centers all across the state, not just ours. There are 17 of them who are doing great work. And you know, one of the things that have been laid bare by this virus is the impact that this has had on the historically ignored population, our Black, our brown, our people of color. We need to make sure that that community is well served. And I know, Senator, that you are one of our strongest advocates to make sure that we see that diversity in who we reach out to. And finally, I just want to acknowledge the people who power the health center. You know, we're not only a primary care provider. In the last 11 months, we've seen 320,000 Connecticut residents and 900,000 visits. But we're also a national player, providing education to 20,000 providers in all 50 states. And in Connecticut, we are educating all of the nursing homes in a partnership with both the private and the not-for-profit in a one-year program to make sure that they're equipped to manage it. And that can't happen without the assistance of leaders like Dr. Margaret Flinner, who co-pilots the health center with me, Meredith Johnson behind her, who is our chief of staff, who really, Governor, she was here 7 days a week, making sure that this stood up. Mike Pasacco from our facilities, Yvette Highsmith, Francis, Yvette, and Governor, I know you've seen her at many press conferences with her, Amy Taylor, our regional vice president as well, and so many others who make such a difference in our lives. And with that, let me introduce our good friend, Dr. Gifford from the Department of Health. Thank you.
Thank you, Mark, for that kind introduction. Good morning, everyone. Governor, Senator Blumenthal, Madam Mayor, friends and partners from Raytheon and Pratt and Whitney. Good morning, everyone, and thank you for joining us. As I was listening to Mark talk about this effort that we have here, it really struck me that this is an example of how Connecticut is being successful so far in our vaccine rollout. And it's a great example of the partnership between communities, private partners, and government, and our great partners in the National Guard. It's taken all of those efforts to bring this quickly to fruition so that we can get our 75 and older and our healthcare workers and medical first responders vaccinated quickly. We have been in the top 5 states since this rolled out in terms of both the percentage of the vaccine that we've been using and the percentage of our population that's been covered with the vaccine. And the reason, one of the many reasons that we've been able to accomplish that is the direction from Governor Lamont is that we want to have these kinds of public-private partnerships to get our vaccine rolled out. So this is a terrific example. We're so grateful to all who've been a part of this. I want to give a special shout out to our partners at United Way 211 who are helping with the appointment line. You have to have an appointment to get your vaccine here. And we went to our friends at United Way 211 not that long ago and said, can you help us stand up this vaccine access assistance line? And they said, absolutely. And they stood it up in short order. Last Friday, they doubled the number of people that were answering phone calls because obviously the demand is high. And we'll be adding even more people this week. So that's one way that people can get access to vaccine in addition to working with their healthcare providers and going online to use the online system. So that's another example of this really strong partnership, and again, great thanks to United Way 211. So with that, I will again say thanks to all of our partners for your terrific work, and I will turn it over to Pratt & Whitney President Chris Cagli.
Well, thank you very much, Doctor. Today is an exceptionally proud day in Pratt & Whitney's 95-year history. You know, we've got 10,000 employees here in the state of Connecticut, 3,000 on this site alone who come in each and every day as essential employees to support our country's military and critical infrastructure. And we're incredibly proud to do our small part in fighting the pandemic and, of course, being part of the partnership with the state of Connecticut and CHC and the town of East Hartford. People have talked about how quickly this came together, and that's true. And it's been a real testament to the tremendous teamwork with the partners in this initiative. I will tell you that many iconic figures, historical figures, and aircraft have been on this retired runway. And to see it now be transformed into the largest vaccination site and be chief among the key things that we're doing to fight this pandemic in the state is truly a proud moment. I know it's proud for me, it's proud for our employees on this site, and it's proud for those retired employees who spent much of their career here in East Hartford. So again, I want to thank all of the partners for their efforts, and I do want to put in a last plug, much like Mark said. If you're eligible for that vaccine, please sign up, please come and get it. Let's save lives, let's get our communities back in order, and let's get businesses back up and running. So with that, I will turn it over to Senator Blumenthal. Thank you.
Thanks, Chris. And I'm not surprised that you've done such a great job here because you make the best jet engines in the world. And I'm proud to fight for the national defense that Pratt helps to guarantee. Mark Maselli thanked a lot of people. I want to thank, first of all, my partners in the delegation, John Larson, Chris Murphy. Our whole delegation works together as a team on behalf of Connecticut. And I want to thank Mark because over decades, not just this year, but over decades, he and the Community Health Center and all of our federally qualified community health centers have been the backbone, literally the backbone, of our health system in the state of Connecticut. And they have been there for countless people when they need that kind of effort. Thanks to Governor Lamont, who has put Connecticut at the forefront of providing vaccines. We are at the top of the distribution of vaccines in the country, the percentage of our population, and the percentage of the vaccine supply actually used in vaccinations. You've read that a lot of states haven't used more than half of the vaccines available. Connecticut is in the mid-70 percentage-wise in terms of using the available supply. That's a tremendous accomplishment. And the percentage of people vaccinated has been at the very top. We're among the top 6 or 7. So I'm going to be very blunt. Donald Trump cost us time. Donald Trump's falsehoods and failures cost Connecticut and the country time in fighting this pandemic and administering this vaccine. Joe Biden inherited a black box and a bare cupboard. The black box was a complete lack of reliable information, particularly as to the science that underlies this pandemic effort, and the bare cupboard was the lack of vaccine. Well, we're uncovering a lot of the information we need to fight the pandemic. The scientists have been liberated. Dr. Fauci is back. And we now have the facts that are needed to fight the pandemic. What we need now, and Joe Biden is doing it, is a massive national vaccine strategy that gives Connecticut the vaccine supplies it needs to provide these folks in line here with the life-saving immunity that is safe and effective. Safe and effective. If people take away nothing else that's been said here, this vaccine is safe and effective. When you have the chance to get it, do it. And as Mark said, the biggest thing you can do is tell others that it is safe and effective. So part of that national vaccine strategy is using the Defense Production Act to make more of the vaccine, double, triple, quadruple the manufacturing every day, to bring more vaccines online. We may soon have the Johnson & Johnson vaccine, and to distribute it using pharmacies, using sites like this one. Connecticut is ready, willing, and able. In fact, in New Haven today, the Hill House High School is opening. In Waterbury, Post University, all around the state, the sites are opening. Very exciting, very promising, but very challenging in terms of getting that vaccine. So I am going back to Washington. Literally, I'm going to get in my car and drive back now and fight hard for a next round of pandemic relief that includes $20 billion for more vaccines. That's a beginning. We'll probably need a lot more money. We should not skimp on safe and effective vaccines. They will be the savior, along with continued precautions like wearing masks, physical distancing, hand washing. They will all be necessary for months to come, and they are part of that strategy. And let me just finish by saying that strategy has to be fast, fair, and complete. And it has to be fair. There's a racial justice component here. We need to reach those communities that have been underserved so often in the past. And that has to be a part of the national strategy as well as our state strategy. And I want to thank our state legislature. Jason, thank you for your leadership. Our state legislature has shown the way on racial justice work, particularly on policing. So let me just finish. Today, the article of impeachment will be delivered to the Senate. I know that's going to be on a lot of people's minds, but we need to move forward on a national vaccine strategy and another pandemic relief program that includes more aid to small business, more stimulus payments, more assistance for state and local governments, and more vaccines for the entire country, among many of the elements that are needed. And we need to think big. The Biden administration is thinking big and bold with $2 trillion. That's the kind of magnitude that we need to fight and win against this pandemic. And with that, let me introduce the state's leader who has championed successfully bringing us together and working as a team. And thank you, Governor Lamont, for your leadership.
Very, Dick, thank you. Hey, good morning, everybody. As a football fan, I can tell you Connecticut's been doing pretty well for the last 11 months, playing really good defense. Today, we're going on offense. Today, we're going to make sure that we have as many of our people vaccinated as quickly as we can, safely as we can. Look at these lines of hope right here. This is what this means. People know what a difference this is going to make for our state and for our country. And I heard the word partnership a lot, and we couldn't do it without all of you guys. You know, Mark, what Community Health is doing here and other places around this state, making it easier for us to get vaccinated. Chris, thank you. I love that. Go beyond. Pratt has been just an amazing partner for the state, going back, you said, 95 years.
We're going to get you one of these.
Yeah, I like that. I kind of like that. You know, Marcia and Deirdre and Jason, I mean, this is an effort that really makes a difference. And Chris reminded me when he talked about the history of this landing strip and what it meant then and what it means today. And that's what change is all about. You know, it was back in 1931. And this was transformative. And the first biggest landing strip around. And Calvin Coolidge and Herbert Hoover came, I was reading. What a day that was. And I have a story I always tell my kids. Please bear with me for a second. But Calvin Coolidge was otherwise known as Silent Cal. And a man of very few words. And he was sitting at one of those White House parties and hadn't said a word for the entire dinner. And the chatty hostess was sitting next to Silent Cal, and she said, I bet my friends I could get you to say just 3 words, Mr. President. And Silent Cal said, you lose. Well, that's not Connecticut. You know, Connecticut is winning. And I will say, it was mentioned, Mark, you said, tell a friend that this is easy, tell a friend that you can register online, tell a friend that you can telephone in, and what a difference it is. But at this point, I hate to tell you, tell a friend who's 75 and over. You know, Hartford Courant said, oh, it's too confusing, we don't know who's eligible. It's not that confusing. Right now, it is 75 and over. And pretty soon, we're going to be expanding that. But the good news is that we can get people vaccinated. This site right here can vaccinate all the doses we get over the course of a week right now. And if we can double, triple, quadruple the number of doses coming into Connecticut, we can double, triple, and quadruple the number of people who are getting vaccinated every day. So, Dick, that's what you and I got to work on. Hey, you've only been in the majority for about a week. You're really making a difference. That's pretty good. And that's one of the things I'd like to do. Where are the choke points? What's taking so long? How can we ramp this up? How can we quadruple the number of vaccines coming into this state in less than 45 days? You know, Deirdre and our team are ready to do this. And this is the type of innovation and partnership that reminds you that we're ready. And this is how we're beating this virus. Thank God. And thanks for you all being here. Guess that's it.
Any questions?
Can we ask questions? I always have one.
Sure.
Governor, on Friday, the Vernon town administrator said that the supply wasn't an issue in Connecticut. Rather, it is the signing up. You might be 75 years old or older, and online is hard. You might not have access to internet. You might not be able to get a ride. Are we working on ways to make this more accessible to all people in Connecticut?
Oh, absolutely. I'll let Deirdre start with that. But look, I would tell that town manager, if you have a problem, you want to solve a problem, give me a call. Give Deirdre a call. Give Josh a call. You had 110 vaccines you got to administer. We'll do that. Make the calls. We're empowering the senior centers to make calls, public health centers to make calls. If you want to solve a problem, give me a call. If you want to score political points, just have another press conference. But Deirdre, do you want to add to that what they can do?
Yep, so you asked about ways that we're making vaccines more accessible. And we understand that there have been some challenges in the appointment making. We hear it. And I want everyone to know that our team is on it. We've been on it pretty much 24/7. I mentioned already the expanded number of people that are going to be helping to answer the phones at the United Way 211. We're working on improvements, and we've already put improvements into our website. And then we're working with our community partners. Remember, those are the three ways that you can get an appointment: online, through the phone line, and through your healthcare provider, who will reach out to you to offer an appointment. We've been reaching out to our provider partners, such as CHC Inc. and others, to make sure that we understand if there are any barriers there and helping them to make vaccine more accessible. So we're continuing to work on those things. Every single day, you're going to start to see improvements every single day. The bottom line, as everyone has alluded to, is we're getting about 46,000 first doses every week in Connecticut. So we don't have enough vaccine to vaccinate everyone who wants it right now. We're all going to have to be a little bit patient, but keep trying to get that appointment. And if you're 75 and older, we want you to be vaccinated, and we'll get you a vaccine, and it just may take a little bit of time.
One of those issues is
as
that
of last week, the phone line was only making appointments for this site. Has that been changed? Are there more sites that people can make appointments to the phone line?
You're correct. That the line was only giving appointments for this, but we understand that people may not, this may not be ideal location for everybody, obviously. So we're adding new providers. We should have about 3 additional coming on in the next couple of days, and then we're working with additional providers around the state to make sure that the phone line can provide appointments for other sites as well.
And where are those other 3 sites that will be added this week?
I'll get you the names. I don't have them off the top of my head.
Thank you. And
we
Dr.
saw
Gifford,
some
with
of the
that phone
retail
line,
pharmacies come online at the end of the last week. Walgreens is going to be having some COVID vaccine locations in Connecticut. So how much does that help? And is the retail pharmacy vaccine supply separate from the allocation that the state gets?
Good questions. No, the retail pharmacy allocation comes from our 46,000 doses per week. Same with the long-term care pharmacy partnership. That comes out of the state's allocation. And retail pharmacies are slowly joining, but they are busy vaccinating in our long-term care facilities, and they will probably be a larger part of the solution a little bit later as we get more vaccine. We are starting to enroll them, and you might start to see some appointments become available at retail pharmacies over the coming weeks and months, but that will probably really ramp up a little bit later in the process.
And I also just wanted to ask you, we've been seeing a lot of good news when it comes to the nursing homes, the infections and the deaths starting to drop. Wondering though if we're also seeing less infections within the hospitals, and are we tracking those numbers as well?
Well, our hospital, as the governor shares twice a week at his press conference, our hospitalization numbers for COVID have been relatively steady for a number of weeks now. You're talking about infections among
the hospital workers
who
received the vaccine, just like nursing home staff, you know, are we seeing those numbers drop?
Yeah, we don't have that information yet, and we're very optimistic, as you said, about the nursing homes. We've got some partners at the Yale School of Public Health who are helping us to look at that, and we're very optimistic that we're going to start to see those infections and deaths and hospitalizations decline once everyone's fully vaccinated in the long-term care facilities.
Dr. Gifford, with the 211 number, will there soon be any Spanish? I know that's been an issue too. Any Spanish translation services, or maybe sign language if you need to call in and you need that?
Yeah, multiple languages are available through the United Way phone number, and we're working quickly to get multiple languages available on our website as well.
Governor, I know it's mostly a supply issue, but do you have any timeline on when we could perhaps see an expansion into 1B, or that's it?
Well, I think you answered that question. It's a supply issue. I think we're going to go through the 75 and above over the next 2 to 3 weeks, so making real progress there. We maybe are getting a little bit of good news on Moderna. We may see a few more vaccines there. Pfizer told me that they could have the capacity to double what they're producing, over the course of the next 30 to 45 days. So I think there's a trend line that's in the right direction. Hey, in terms of how we have to reach out to communities and how important it is that they get vaccinated. Jason, you're right on the front lines in terms of people making calls and the questions they have. Would you mind just saying something on that?
Sure. No, thank you, Governor, and thank you, everybody. Yeah, no, I mean, part of the reason why I wanted to come here today was to see it for myself, to take pictures for myself and share it on my social media so that I can reach out directly to my neighbors who live here in East Hartford and certainly my constituents who live in East Hartford and Manchester. You know, every car that pulls in here is a little bit more faith to returning to normalcy and giving people that psychological confidence that we can go back to life as we knew it. And we know we're going to have to continue to make adjustments over the next year, continuing to wear masks even if you have a vaccine. But it really takes all of us who have a presence and who have a bully pulpit from which we can communicate to our neighbors that this is so important that they go out there and continue to get tested and that they continue to show up here and get that vaccination so that we can get back to life as normal as possible.
Dr. Gifford, when people go to make an appointment in the online system, how does it prioritize where to send them, where they should go to get the vaccine? Some people are reporting they'll be in like the southern end of the state, and the system will make an appointment in the northern end. They'll drive halfway across the state to get there. How does that all work?
Yeah, so one of the things that we're working on right now is a map for people who are scheduling appointments, so that they'll be able to see where appointments are available all over the state, click on a location and see when the next available appointment is. We realize that people want to, of course, if they can get a vaccine sooner, go close to home, but also some people will go where the first available appointment is, and they'd be willing to drive. So that map should be, we've been working on it, it should be ready within the next couple of days, and that'll give that functionality to people.
One other thing, you guys were saying that we were going to do the congregate setting sort of in line with this other operation here. Where does that stand?
So we've started that. You may have seen some coverage of a homeless shelter that got some vaccinated last week. We have a part of our team at DPH is working on the agencies that are contracted with the state, so group homes, substance use facilities, etc. We're working on setting them up with a vaccination partner so that we can get those clinics going.
How about prisons?
Don't have a timeline estimate for you on that one yet.
Dr. Gifford, we've just been getting a couple questions from people saying, I got my vaccine, my elderly loved one in a nursing home got their vaccine. When will visitor restrictions start to ease?
So as I mentioned, we are looking at the impact of the vaccine in nursing homes, and it's too early to predict. We certainly understand how much people want to get back to normal visitation in nursing homes, and as soon as we can, we will start to ease those restrictions. We need a little bit more data. We want to have confidence that people are vaccinated. I would encourage workers in nursing homes. Some of them have had a little bit of reluctance to get vaccinated, and we understand that, but as we've said today many times, this is a safe and effective vaccine. Many of your peers have gotten vaccinated, and so we're hoping that we start to see those numbers increase as well, and we encourage people to reach out, ask questions, talk to your peers, and find out more about the vaccine.
We're watching this massive operation take place. There's parking and there's lines and this. Who's covering? How are we going to pay for all of this?
Step up, Dick.
Yes, sir. What we're seeing here has to be duplicated all across Connecticut and the country, and it's going to take billions and billions of dollars. That's why we're fighting for not only more vaccine, but that $20 billion that Joe Biden has promised. That includes all of the nuts and bolts, the delivery process that makes the vaccine a vaccination. As you know, you've heard it said a zillion times, a vaccine is no good unless it's in people's arms, a vaccination. And this kind of logistics is not cost-free. We need to pay for it, and it's the federal government that has to step up. For almost a year, the federal government, Donald Trump and his administration have said, it's your problem. It's the state's problem. The federal government now is stepping up, and it's going to tell the American people the truth about the cost of this kind of operation and about what is necessary to overcome this pandemic. And Connecticut's been at the forefront of leading the nation, thanks to the governor and this kind of team. But we need the federal government now to really do the job.
Is that of stress to community health center? You have a lot of work going on, a lot of people and jobs and.
Well, I think the state's done a great job. And I think the senator is right. It's really going to be out of Washington. This is above the pay grade of any individual state. Really requires the national government to recognize there are costs, as the senator said, exceptional cost, but there's enormous cost if we don't get this done. And I think the governor has been spot on. We need to get as many people vaccinated in their order, but as we can, because if you look at the variants that are happening, the South African variant or the UK variant, there are real concerns if we don't vaccinate, because we'll have more hosts where mutations can happen. So this is critical that we all move forward. And, frankly, as I said, we're going to have to deal with the issues. We'll figure out who's going to pay for it later, but we all have to stand up and get this done.
You say that you'll figure out who will pay for it later, but this site is already here right now.
Yeah.
So who's paying for it right now?
Well, right now the health center is certainly providing leadership. I know we've had great partnership with the state, but I think we're all looking to the national government. We got a great leader in the senator doing it. They've got to understand the sense of urgency. And I say that past the cost. I think we need to understand that if these variants get a hold in our country, we could have enormous problems that we can't resolve with the current vaccines. So we really need to do it. And, some of us, I know the hospitals are doing a great job of trying to stand up. At our health center, we're trying to do it. We had the resources to do it. We said, let's put the priority of vaccination in front of the cost, but we're going to have to get to cost at some point.
But until that federal funding comes through, who's covering the cost right now?
Right now, we are, and I know the state will be supportive on helping with the cost of containers that they have been on testing and on other issues that we have to deal with. But I think every provider in the state faces the same problem. The reimbursement structure's not adequate. This is not a problem the state can solve alone. This is one that really requires the national government.
And as you mentioned, this is something, a model to be replicated perhaps in other states.
Yeah.
Look at what's the price tag we're looking at for those other states who might.
Well, I think there's some efficiencies. We have the National Guard who's going to help. I think more of them have been mobilized. FEMA, I understand, is giving 100% reimbursement for National Guard. Yes. These things are critical importance, and I know the commissioners has worked on trying to get more vaccinators, volunteer, and some who will be paid, but all of those come together, and then we've got to, in Connecticut, we don't have land or oil, but we've got critical thinking. We've got to bring that together, bring the logistics people together, and try to make it as efficient as possible.
Dr. Gifford, I know you mentioned that there were changes to the centralized scheduling system. Were any of those updates and changes specific to the issue that allowed some folks to jump their spot?
Yes, that has to do with, those were the directions that we gave to the employers that were uploading their lists, and we've been working with those employers since day one to make sure that only the appropriate lists are being uploaded, and we're continuing to send out reminders, as many of you have seen, and this is a very minimal part of the number of people getting vaccinated. As you can see from the cars going through here, we've been doing spot checks with our providers, and the vast majority of everybody with an appointment is over the age of 75. We still have healthcare workers coming through that are younger than 75 that are eligible for their vaccine under Phase 1A. And we have some inspectors that are out from DPH checking various clinics. So this issue is really a very, very tiny proportion of the very large numbers of our seniors, we're happy to say, and see getting their vaccine.
And Dr. Gifford, over the weekend, the CDC director said she didn't really know how much. She said, I don't know how much vaccine our country has. But we know it's 46,000. Or how do we keep track, just so people on Facebook Live heard that comment this weekend from her?
So we're given an allocation, a pro rata allocation based on our population every week. And as the governor mentioned, it varies slightly from week to week, but we know several days in advance how much vaccine to expect in Connecticut for the following week. We then work with our providers, and they ask for the vaccine that they like for the following week, and we divide up what we're getting to the providers based on what they can administer. And that system has been working fine so far. The big problem with it is we don't have enough. As to the entire inventory of vaccine in the country, I know that the new administration is busy figuring out what's available and what's left to be distributed.
Thank you.
Senator,
Thanks, everyone.
Were you longer hearing that, though, that you didn't know how much vaccine there was?
I was just going, there's probably will just take time for one more question that was just answered, and then we're going to try to wrap this up.
No, it wasn't. I was going to ask the Senator what he heard
Sorry.
about the CDC director not knowing how much vaccine there was at the national level. Did that alarm you, or do you pin that on the Trump administration?
Well, as I said, the Biden administration inherited a black box and a bare cupboard. They've been in office for a few days, and this fact is absolutely essential. We need to know how much vaccine supply there is and how much more can be manufactured and how quickly. But what encourages me beyond words is the determination, the absolute determination to get the facts and to get the vaccine out to people. And I am very sure that we're going to be working in a partnership with the Biden administration, some of the best minds in the world and some of the best scientists. So I am alarmed that there's a black box, but the failures and falsehoods of the previous administration and the muzzling of great doctors like Dr. Fauci are the reason for it.
Thanks, everybody.
Thank you.
Thank you. Thank you.
I didn't want to change it.
What's that?
Don't do we're going to do it about where do you want them? You can just come right over here. Okay.
Okay, I want to make sure we work.
Oh, we're sitting here.
Oh, sure, great. Yeah.
You want to get? You want to just do a gaggle with everyone? If everyone's interested, yeah, sure. Smile.
How you doing today, Senator?
Good. How are you?
I'm good. Nice and warm.
Yeah.
I'm about to go to Alaska.
You want to throw them into the gaggle? Everybody good? Senator, how confident are you that you're going to get enough Republicans to go along with Democrats to convict for impeachment?
As of today, I have no great confidence that there will be 17 Republicans to convict. But as more facts come out, I think the case is powerful. And I've talked to a number of my Republican colleagues who were so repulsed and angry about what happened on January 6th and the president's inciting it. I think they're going to reach into their hearts, they're going to look in the mirror, and they're going to look at history, because history will haunt them if they acquit the president again. But the main point is there has to be accountability. Even if the president's out of office, he needs to be held accountable, and we can do both, hold him accountable and move forward on fighting the pandemic and confirming the Biden nominees.
And the main goal in this, would you say, is to prevent him from running for office in the future, or what is the main goal?
The main goal here is simply accountability. He broke the law. He incited an insurrection. He instigated domestic terrorism. And 5 people are dead as a result. He needs to be held accountable. And at the same time, we need to move forward beyond the falsehoods and failures of the Trump administration so that we fight the pandemic, revive the economy, and confirm all the Biden nominees.
Senator, I know you're going back to D.C., I guess right after this. How much confidence do you have that you're going to be able to hammer out compromise or whatever on this $1.9 billion coronavirus relief program?
We're going to have a compromise because we absolutely have to do it as a nation. We are fighting the greatest crisis in recent history, maybe in the last century. And I think that hope and healing, bringing us together, unity, are a common feeling now in Washington. We need to come together. That's what the country wants. Every one of my constituents, every person across the country knows we need to do it. And I am very, very hopeful that we can come together on a pandemic relief program. We need to move on, turn the corner, fight this pandemic effectively, put America back to work, and make people feel safe and secure again. Thank you.
Thank you.